Hello everyone, you're watching sqadia.com and I am Dr. Hamad Haidar. Today we'll be discussing the recurrent patellar dislocation. So what it exactly is recurrent patellar dislocation or recurrent patellar instability? As the term suggests that it's either instability leading to dislocation or there is actually acute or chronic recurrent dislocations of patella due to multiple factors. This could be related to for example, soft tissue problems which are around the knee or which are actually static and dynamic stabilizers of patella, or could be problem with the bony issue or the bony anatomy around the knee. For example, problems with the lateral condyles or trochlear groove or even the patellar tilt as well. All these bony abnormalities can also be leading to recurrent patellar dislocation. And then above all, may have habitual dislocation in which the usually patient has a tendency to dislocate during from knee flexion when goes into extension, as it was the case with our case study as well, that whenever she went from flexion into extension, there was positive uptension test, and this resulted in actually a slightly lateral tilt or movement of the patella, leading to patellar dislocation as well. So if you see, this is a normal position of patella. You have medial femoral condyle and lateral femoral condyle, and it's actually positioned over the trochlear groove. And it's, as you know, the patella is a sesamoid bone. That means on the three sides is actually situated from the patellar tendon. You have this, and then you have a quadriceps tendon over the top of it. So once it's inside the tendon, it actually cannot move unless there is problem to these tendons and ligaments as well. There are certain constraints from the medially as well, which is the most important static constraint. It's the medial patellofemoral ligament, which is actually attached on the medial side. If that goes away, then patella can go laterally, or if these become weak, or actually this quadriceps, there is a malalignment of quadriceps, their contraction can result in the lateral subluxation or dislocation of patella, which was actually happening with our case study as well, that whenever she contracted the quads, this resulted in a dislocation of the patella. Other options which can lead to problem is if we have the problem with the lateral femoral condyle, for example, in case of lateral femoral condyle hypoplasia, or what was present in our case as well, which was the external rotation, external tibial torsion, which could be isolated or which could be part of the miserable malalignment syndrome. This may be leading to increased patellar instability and recurrent patellar dislocation. This is in the normal position. Usually we have medial collateral ligament, lateral collateral ligament, and quadriceps tendon and patellar tendon are actually, the bone is a sesamoid bone, that is, it is present inside the tendon and it's surrounded from all sides and makes it stable. And this is how it can be displaced. That is usually the dislocation, although there other classifications are there as well. There could be medial dislocation or central dislocation as well, but those are highly rare. Most common dislocation of patella, especially in the case of recurrent patellar dislocation, is always towards the lateral side. And mostly there's different factors, which could be the problem with the medial patellofemoral ligament, problem with the tightness of the lateral structure, could be problem with the bony anatomy over the lateral femoral condyle, external tibial torsion, or even the increased lateral patellofemoral tilt, or even the patellar hypoplasia as well. So all these factors actually contribute in some way or other, leading to increased lateral patellar subluxation or dislocation, which is commonly termed as recurrent patellar dislocation or increased patellar instability.